Thanks for watching the Medical Class 901 with Dr. Chi MD, an infectious disease specialist and professor of medicine in Memphis, Tennessee.
Let's go!
Welcome to Medical Class 901. I am Dr. Chinelo Animalu, infectious disease specialist and professor of medicine at the University of Tennessee Health Science Center here in Memphis. So we are currently in the Studio 67 in the 901 zip code, Memphis. And so our show today, we're going to focus on a very common infection that affects billions of people worldwide and millions of people living here in the United States, the common infection called herpes. I'm almost certain that every adult here has heard about herpes. So today, as your infection doctor, we are going to talk about every single thing you need to know about herpes. And you guys are free to send in questions. You can email questions, whatever questions you have about this show, and I'll be more than happy to answer and address your questions. So let's go. Welcome back to the show. This is Medical Class 901 with Dr. Chi. I am Dr. Chinelo Animalu, infectious disease specialist. And so today we will be talking about herpes. Yes, herpes. This is something that is so common. I'm sure everyone listening to this show has heard about herpes. We're talking about something from the pediatric group, that's from children up until adulthood. So I remember once I had someone, complaining about a friend, and she was like, oh, she's just like herpes. She doesn't go away. And so that really got me laughing. And so we're going to talk about herpes as that infection that never really goes away. So what is herpes? Herpes basically is a type of virus. It's called the herpes simplex virus. And this is an infection that is acquired, early in life by most people. So for us as kids, let me give you guys just a quick scenario. When there's a new baby and people come around, oh, baby, mwah, 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 everybody's kissing. That is how we all get herpes. And so according to the World Health Organization, about 50 to 80% of all Americans have herpes, have tested positive for herpes simplex type 1. I'm going to talk about the different types. And then about 5.7 billion people in the entire world are living with herpes. So, the numbers are like, oh my God, what is this? But it's nothing to freak out about. So I'm just going to give you guys a little bit lowdown, and hopefully at the end of this discussion, people should be comfortable with what herpes is, and it's not something you tell somebody, oh, this person moves like herpes or whatever. All right, so this stands for HSV, herpes simplex virus. There are commonly two basic types. And the one that everybody knows about is called the herpes simplex virus 1. So I'm just going to call it as HSV1. People have heard about cold sores, fever sores, or canker sores. Okay, so in those days, I grew up in Africa, when, you have malaria or other febrile illnesses, people develop sores around their mouths, and they're like, oh, you have a cold sore. Why is it called a cold sore? Because it's something that tends to occur when, you have a cold or, you have fevers. We call that in the medical term febrile illnesses. And the main cause of this is actually the herpes type 1. And so it's nothing to freak about. It's nothing for people to panic. Like I said, almost 80% of our population here in the United States have herpes. So two basic types. The herpes 1 is the one that causes the cold sores. Medically, we just call it like herpes labialis because it does occur around the lips, and sometimes for some people inside the mouth, we call it the buccal mucosa. The second type is called the herpes 2. The HSV type 2. This is the one that causes genital ulcers. So this is the one that I would not use the word worry about, but obviously if you have ulcers in the genital area, you want to know what is, it could be herpes, it could be syphilis, it could be anything else, we don't know, but that's basically what that causes. So now, in the last few years, or maybe in the last decade or more, where there's more oral sex practices, we are now seeing the herpes type 1. Remember, that's the one that causes the oral lesions, that is the lesions in the mouth area. So we are now seeing that also causing lesions in the genital area, whereas before, decades ago, the HSV2 is equals to genital and HSV1 equals to oral. But right now, we're now seeing HSV1 and HSV2 causing genital lesions. So let's talk about when we talk about the lesions or the ulcers or the type of presentation that you will see with this type of infection. Like I did mention earlier, the cold sores, so some people when they're sick, all of a sudden they're having this pain in the mouth, tingling, burning sensation, and then you have this, blisters forming in the lips or inside your mouth, and that would commonly, we would consider that to be HSV, because of the unique nature of the lesions associated with this type of infection. So let's talk about transmission. So when we say herpes, when I started off the show, I did talk about, the babies when, people come to visit and, we're giving kisses, we're blowing kisses. So the commonest type of transmission would be skin-to-skin transmission. What does this mean? Basically, if you come in contact with somebody that has active lesions, so somebody that has the cold sores, commonly you're going to see that around the tip of the lip here, on the the angle of the mouth here. For some people, it could be all over the lips. Others, it could be on the tongue. It could be inside your mouth. So any kind of contact, direct contact with this type of lesion, this will be the fastest way for you to contract herpes. And so again, from kissing, any kind of, contact you have with the lesions or the oral mucosa can pass that along, including babies. The second commonest mode would be sexual contact, and that would be commonly through, it could be vaginal, anal sex, or oral sex, anywhere there's lesions. So let's talk about the anal transmission. So if there's lesions, if somebody has some ulcers or they have some lesions in their rectum or the anal area that's behind there, and you have some kind of unprotected sexual intercourse, you would contract this infection. And then the third mode of transmission would be what we call maternal to child transmission. And this will be seen in a pregnant woman who is in labor and has active herpes infection and giving birth vaginally, and the baby having to pass through the birth canal and come in contact with those lesions. That child most likely will be born with herpes. In the normal, civilized, situation, if a pregnant woman has active lesions, the doctors will do everything possible to prevent the woman giving birth through the vaginal way. But if, unfortunately, she still ends up giving birth that way, and she has active lesions, we will go ahead and start treating that baby just to protect that child from, acquiring this infection from the mom. So what are the risk factors for contracting this infection? The commonest, again, would be skin-to-skin transmission, making sure that, you avoid contact with somebody that has active lesions. And just for general, it doesn't have to be herpes. You don't want to start kissing somebody that has ulcers or wounds all over their mouth. That's just not nice. Yeah, so just kind of stay away, if somebody has lesions, in their mouths or inside their mouths or their lips or anywhere like that. Another would be low immune system. So for when we talk about immunocompromised, people, what does that mean? It means your immune system is not up to par. This could be from other infections such as HIV. It could be from medications, for instance, people that have lupus, rheumatoid arthritis, that have cancer, that have to take chemotherapy, or biologics, any kind of medication that affects the immune system, basically would lower your immune system. And so this puts you at high risk category of those that can contract herpes. Again, bear in mind that almost 80% of the adult population here in the United States have herpes. So it's not like a death sentence or anything. So what is one unique thing about this virus? It stays with you. There's no cure. It lives with you permanently. Okay, so, but it's not something that bothers you, every single day. So I'm going to talk about the symptoms and how we go from here. So commonest symptoms. Now we've talked about 80% of the population having herpes. So the question would be, Dr. Animalu, like everybody, so does that mean that everybody is walking around with herpes or something like that? No, not exactly. So, but let's talk about the common symptoms you're going to see. It comes in stages. The first stage is what we call the prodromal stage. What does that mean? There's nothing, there's no lesions, there's nothing. You just don't feel too well. It could be fevers. You could have some lymph nodes swelling. It just could be, that you have some tingling perhaps around the mouth area. It could be for women, the vaginal area, or for both men and women, it could be in the anal area. So this could last for a couple of days. There's nothing non-specific. And bear in mind also that for some people, they could be completely asymptomatic. What does that mean? It means that there's no symptoms, okay? And that would be majority of people. So now let's go from that prodromal stage, which is that initial stage where there's no rash, there's no ulcers, there's nothing. It's just that you kind of feel like something's, off somewhere. And it could be anything, right? We're in the flu season. It could be the flu. It could be COVID. It could be anything. It could be fatigue, right? It could be medication. So nothing in particular. So there's nothing that will point you at this point and say, hey, that you have herpes. So the next stage would be the blister formation. Now at this point, you start seeing very tiny blisters. What are blisters? Those are rashes that kind of contain fluid, clear fluid. It almost feels like, tiny rashes that has water, like, very clear fluid, within them. And so that's what we call blisters. They will begin to appear in the area of infection. And I need to mention to you guys, when I did talk about the infection never goes away, so where does it stay in the body? It goes to hide in our nerve fibers along the spinal cord, okay? And it will lay dormant. What does that mean? It stays there. It will stay there for years, sometimes for 10 years, 20 years, 30 years, 40 years. It does not disturb you until something happens to your body or to your system, and then it comes back up. And so when it happens, we'll talk about the different stages. Then you can see that this person has active herpes infection. So the next stage would be the blisters. They start busting open. This is a time that please stay away from anybody you see with this kind of lesions in their mouth, in their genital area, in the vagina, in the rectum or anus, in that area. This, one of the major things that will help us as healthcare providers, suspect this is the type of pain. We have different types of pain, but the pain that's associated with this is often described as burning sensation. So it comes with itchy, very burning pain. You feel like somebody has just, lit your area, your mouth, down there, up there, anywhere, lit on fire. So it's kind of very unique. And then after that, you have the crusting phase. And these are things that will last for a couple of days, right? And for people who are immunocompromised, it could be really, really, really painful. And for most times, for most of these patients, you end up going to see your doctor. And then from there, we go into the healing phase where, it's crusting and it's beginning to heal. The lesions are healing. And, it might take you from a place of, completely miserable to, you're still uncomfortable, but you're not, back to normal. So for everybody, the degree or symptoms, varies from person to person. But for most times is really very uncomfortable, and most patients that have this who end up, calling their doctors or going to see, their doctor or pharmacy or whoever their healthcare provider is. So we will talk about the different stages again in a minute. So we're going to take a short break and we will come back. This is Medical Class 901 with Dr. Chi. Welcome to Fun Facts with Dr. Chi. I am Dr. Chinelo Animalu, Infectious Disease Specialist and Professor of Medicine. So we're going to talk about just some basic points to know about HIV. So what does HIV mean? Human immunodeficiency virus, which is a virus that we can, pass from one person to another through sexual intercourse, or sharing body fluids, or through blood transfusions, or by sharing needles. About 39 million people are affected worldwide, and it's a major cause of mortality in the world, meaning death. It causes death. And the end part of HIV is called the AIDS, and this means somebody that has untreated HIV infection, and this would have run for many, many, many years, and sometimes some decades. You do not get HIV from kissing, from hugging, from sharing utensils, in the households with people. You don't get HIV by saying hello to anyone. My name is Dr. Chinelo Animalu, and I am an infectious disease specialist out of Methodist University Hospital and a professor of medicine, Division of Infectious Diseases at UT College of Medicine.
Dr. Chi, an infectious disease specialist, emphasizes the importance of community outreach in Shelby County. She believes that community outreach plays a crucial role in promoting health and education, providing essential resources and support to improve health outcomes. Engaging with communities actively allows us to share vital information and create healthier environments.
Welcome back to Medical Class 901 with Dr. Chi. I am Dr. Chinelo Animalu, Infectious Disease Specialist, and in today's segment we are speaking about herpes. Herpes. Yes. All right. So we were talking about herpes, two types: the HSV1 that does cause the oral lesions, and then the HSV2 that is responsible for genital lesions, basically HSV1 and 2. All right. So there are two types of infection. Like I did mention earlier, when one contracts this infection, you might have a few days of flu-like symptoms, which are what we call non-specific. It could be anything. It doesn't necessarily mean you have, that points to herpes. Then after that, you go into the different types of infection. So the first type of infection is what we call the primary infection. And this basically, means the very first time you acquired herpes. And this could be, from childhood. Like when I speak to a lot of adults, they're like, I don't remember, ever having this. And absolutely. And that's because most of the infections might be acquired during childhood. I did talk about the cases, new babies, and when aunties and uncles come to visit and everybody's like, mwah, 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 mwah. That's the fastest way to transmit herpes. And so when you're asking a 50-something-year-old, have you ever had herpes? They're like, oh, hell no. But that's because that's something that probably happened in childhood. So let's talk about the primary infection. That's the very first time that you have acquired this infection. And it will come with the non-specific symptoms, and for some people you could have the rash and the blisters that we talked about. That heals and then goes away, and then it lays latent. Latent or dormant basically means that it just stays completely inactive. And this could last for years, many, many years, for decades. We're talking about people in their 70s, in their, 60s, 70s, so it could stay there for the next 20 years, for the next 30 years, for the next 40 years. And then, you have the second stage, which is called the reactivation. And so the reactivation, again, is now when you have another episode, from that very first episode you had, which could be in childhood or during your adulthood. Some people, if it's something that was acquired in adulthood, you will certainly remember because, it comes with, very painful burning blisters. And, usually most adults are going to remember this. And so from this phase, the reactivation phase usually is brought on by stress. So when we talk about stress, what is it? It could be that you have a cold, right? It could be that you had a fever. It could be that you're going through a lot of emotional stress or something that has lowered your immunity. Perhaps you were introduced to some new medications, some biologics. It could be chemotherapy, any kind of medication that does, attack the immune system. It could be, a transplant, somebody that had maybe kidney transplant, liver transplant, and you've been placed on immunosuppressive medications. These are all things that could cause a reactivation of this infection. Mind you, that this has been laying dormant for many, many years, 10 years, 15 years, 20 years, 25 years, 30 years, and then out of nowhere, it just, pops up and you remember, oh my God, I had this, when I was in college or maybe when I was in high school or something like that. Then other traumas like dental extraction, that's like you go to the dentist and a tooth or, you have your teeth removed or whatever. And in a lot of cases, the trigger is unknown. It just happened. Like, you can't pinpoint any particular, incidents, of trauma, of, emotional stress or fevers or anything else that brought this on. But then you go, you're all of a sudden you have these blisters, these very painful blisters showing up in your oral lesion or in the vagina for women or in the anal area. So cold sores, like I said, everybody, for most people, they've had that. It's called cold sores because it tends to occur when you have a cold or when you have fevers and stuff like that. Very difficult to eat or drink when you have these lesions. They're so painful. They're very, like we call it, very burning pain. You just feel like somebody, lit that part of your body on fire. And it can last anywhere between, 7 to 14 days. And so this would take me to, let's talk about treatment, right? So now we have somebody that has these lesions. How can we tell? So what do you do? Like I said, because it's usually something that's very painful, you're going to end up going to your doctor, to your, PCP, primary care provider, to the pharmacist, to somebody to kind of be like, hey, I'm having, these very painful lesions. Very hardly would you have those symptoms of herpes for the first time and you don't run to the doctors just because it comes with lots of pain. So what do we do? How can the doctor tell? There are certain tests that we do for this type of infection, but for some of us, for instance, your infection doctors who've been trained in this, we can recognize the rash and we would not necessarily have to do any blood tests. We can tell immediately that this is herpes and start you on treatment immediately. Now, or the doctor could draw some blood tests and do what we call a PCR test, a polymerase chain reaction test. And what it does is just that it's a blood test that will go to that will test the body, see if you have any of the herpes in you. The other kind of things, you can also break one of those blisters. We'll do a swab and send it to the lab and also check and see if if it comes back positive for HSV1 and 2. Now, your doctor most likely is not going to sit down, twiddling their thumbs and waiting for the next, I don't know how many days for your test to come back. Most times, we're going to go ahead and do what we call preemptive treatment, where we actually start you on the treatment. Why is this important? Because the medications we use, they work best within the first 48 hours of the onset of your symptoms. So if you wait and come to the doctor maybe after 7 days or 8 days, it probably would not work. So we always encourage people to come earlier. But like I said, it's something that will literally chase you off your couch to your doctor's office because it's really very painful. So how do we treat this? This is a virus, and so we use antiviral medications, okay? Not antibiotics. So one of the questions I will always get from my medical students will be, can you use antibiotics? No, sir, you cannot use antibiotics because it's not a bacteria, it's a virus. So we use antiviral medications. So there are certain conditions where the antiviral, are we going to give you pills, or we have to admit you to the hospital and then start you on the IV medication. So acyclovir is the antiviral that we would use in severe cases. We give it intravenously. And so when somebody comes and they are really very sick, or now they have something like blurred vision because herpes, let me note this. What are the complications of herpes, right? It could just be this rash that comes, we treat it and it goes away and you're back to normal, everything is good, you go on your merry way. But for some people, like the category of, people I talked about, like your immunocompromised patients, or, people that the system, their blood, have some other medical issues going on, maybe, HIV or something else, we will have to treat that very aggressively. So if someone with herpes comes and they're complaining of blurred vision, we will freak out as doctors because there's something that's called hepatic keratitis. And it just means inflammation in the eye that can lead to blindness if it's not treated. It can also go to the brain and cause meningitis. Yes, meningitis that will kill if it's not treated, okay? And it's a very, very severe infection that is, literally becomes a matter of life and death situation. And so those would be the cases that we will admit immediately to the hospital and start the intravenous acyclovir. Now, for other people, we can put you on some like Valtrex, some oral pills that we want to start as soon as possible to halt what we call the viral replication. And so, depending on what your symptoms are, we will begin treatment either with IV, which is intravenous treatment, or we can do oral treatment. For most people, you're going to get better in a couple of days, and then hopefully you will remain symptom-free for decades to come. But if, again, something happens, you're under a lot of stress or something else, it could come back quickly. And then just remember to come back to your doctor and we will take care of that. And please avoid, for you as an individual, for people around you, this is something that is so highly transmissible, meaning it can transmit from one person to another very fast. So stay away from, kissing or any kind of intimate setting, no sexual practices for women. If you have lesions in the vagina or in the cervix, no sex till, these lesions heal so you don't transmit it to, somebody, and then from that person to the next one. So my message to you guys is herpes is a very common infection. Up to 80% of population here, the adult population in the US have it. Almost 5.7 billion people worldwide have herpes, and it's nothing to be ashamed of. I want to talk real quick about the stigma that's associated. People like, oh, she has herpes. Oh my Lord, she's promiscuous. No, it doesn't mean that person is promiscuous. Absolutely not. You could just be your first encounter, or you don't even need to have any kind of personal, thing with somebody. It could be from your auntie giving you a peck as a baby, and that's how you ended up with herpes. So no judgment. This is a no judgment zone. Do not judge. And if you go to your doctor, if you're not sure, just ask them to test you for it. So hopefully I've been able to kind of address what herpes, means. So when somebody says, oh, she's nagging like herpes, now we kind of understand what that means. So thank you for your time. And this is Medical Class 901 with Dr. Chi.
Thanks for watching the Medical Class 901 with Dr. Chi MD.
My name is Dr. Chinelo Animalu, and I am an infectious disease specialist out of Methodist University Hospital and a professor of medicine, Division of Infectious Diseases at UT College of Medicine.
Dr. Chi, an infectious disease specialist, emphasizes the importance of community outreach in Shelby County. She believes that community outreach plays a crucial role in promoting health and education, providing essential resources and support to improve health outcomes. Engaging with communities actively allows us to share vital information and create healthier environments.
Thanks for watching the Medical Class 901 with Dr. Chi MD, an infectious disease specialist and professor of medicine in Memphis, Tennessee.